I think I came into public health and actually into academia thinking, what are the interesting questions I want to answer? And over time, the more I'm involved with community partners and the kind of research I do, the more I think about, instead of what do I want to know, it's what kind of information would be helpful to make change, or what kind of questions would help inform decision makers. So part of that was kind of giving up power, and that's kind of scary for a researcher, but I've learned that giving up power actually still results in very rigorous scientific work, but it's also much more reality-based, and I think through that process translates more into solutions. The more relationships I made, the stronger my research, and also the greater the opportunity for my research to actually translate into some kind of change or decision. My community partners are often very insistent upon me having a broader audience than I would potentially otherwise have, and make sure that our results are getting disseminated much more broadly. They also have taught me the power of closing the loop, so giving the information back to people who helped, shared their knowledge, answered the survey. Make sure that you close that loop with them and say, here's how, here's what we learned, thank you for the information, and here's how it's going to be used. The work that I do with the Department of Health to collect the health insurance data every couple of years has really made an impact, in that we know that it influenced the Eliminating Health Disparities initiative, so the funding of that initiative, where we saw really big disparities in who has access to insurance and who doesn't in the state, and so that's been ongoing. That study is now funded by the state every 2 years, which is fantastic, because now we know we have a consistent source of data to know whether or not some of the reform efforts that we're doing in the state are actually working. When I think about it, I got here as a result of really having some tough questions from community partners that really pushed me to do really strong and rigorous research in that area. So I couldn't have done it alone.